Okay, we were discussing about the adverse drug reactions that commonly occur due to these vasodilators, and due to too much vasodilatation activity, there may be increased in myocardial oxygen demand, क्योंकि ये blood vessels जो हैं उनको increase कर देती हैं, जिनकी वजह से हार्ट के ऊपर जो है वो वर्कलोड जो है वो भी इंक्रीज हो सकता है. इसके अलावा ऑक्सीजन डिमांड जो है वो ज़्यादा हो सकती है. So this may occur as an adverse drug reaction related to the vasodilator. And next, come towards some number of drugs that should be avoided for treatment of hypertension associated with other disease or condition. If the patient is suffering some other comorbidity, and there may be a condition of some other disease, and what are these drugs that should be avoided in those patients. So especially in case of pregnancy, the ACE inhibitors, angiotensin receptor blockers, beta blockers, or diuretics, these are contraindications in case of pregnancy. But in case of pregnancy, mostly we prefer the centrally acting agents, like we have studied about the clonidine or the methyl dopa. These are preferable drug in that condition, in the condition of pregnancy. So these ACE inhibitors, angiotensin blockers, and the beta blockers, these are contraindicated in pregnancy. And other condition is the diabetes mellitus. If the patient is suffering from diabetes mellitus, then beta blockers and diuretics are strictly contraindicated. The cause we have already discussed, that why these diuretics are contraindicated in diabetes mellitus, because diuretics causes too much level of sugar inside the blood. So they increase the sugar level and they depress the insulin level. So these diuretics are especially contraindicated in diabetic patient. And next come towards the angina pectoris. If the patient is suffering from some angina pectoris, then the vasodilators are contraindicated in that condition, because vasodilators, they increases the oxygen demand. But if the patient is suffering from angina, there would be unbalance between the oxygen supply and the oxygen demand. And so due to increase in oxygen demand, they may aggravate that condition. So vasodilators are strictly contraindicated in angina patients. And next, come towards some beta blockers. These are contraindicated if the patient is suffering from some asthma. So for the asthmatic patients, beta blockers are contraindicated, because बीटा रिसेप्टर्स का मैंने आपको बताया था, बीटा 2 रिसेप्टर्स जो हैं वो स्मूथ मसल्स के ऊपर प्रेजेंट होते हैं. एंड स्मूथ मसल्स जो हैं स्पेशली द लंग्स के ब्रोंकियल मसल्स जो हैं उनमें प्रेजेंट होते हैं बीटा 2 रिसेप्टर्स. अब बीटा 2 रिसेप्टर्स को अगर ब्लॉक कर दिया जाए तो लंग्स जो ब्रोंकियल होता है उसकी कंट्रैक्शन हो सके. तो एस्थमा में ऑलरेडी जो है वो ब्रोंक्यूल्स जो हैं कंट्रैक्टेड होते हैं, तो बीटा ब्लॉकर्स जो हैं वो इस कंडीशन को एग्रावेट कर सकते हैं. So these are contraindicated for the asthmatic patients, and also the beta blockers are contraindicated if the patient is suffering from some peripheral vascular diseases, and if the patient is suffering from some congestive heart failure, then calcium channel blockers are contraindicated, and except the amlodipine, other calcium channel blockers, they are contraindicated in CHF patients, and also the alpha and beta blockers, they are also contraindicated in congestive heart failure patients. So these were the different conditions in which these drugs are strictly contraindicated, and these drugs should not be taken for those patients if they are suffering from some comorbidity or from some other disease. And these are the references for detail of today's lecture. You can concern different books from which the today's lecture and the slides have been prepared from this. And especially you may concern the Lippincotte's illustrated reviews. Lippincott will be preferable book for your concern. And other for detailed study you can concern different references. And so these were all about the antihypertensive drugs. Yes क्लास अगर कोई क्वेश्चन है किसी के पास तो वो पूछ सकता है. एंड CRGR काइंडली आप मुझे टाइमर सेंड कर दीजिएगा.
ओके मैम.
ओके साइट्स जो है वो मैंने ऑलरेडी ग्रुप में शेयर की हुई है, तो आप लोग उससे कंसर्न कर सकते हैं. डिटेल स्टडी के लिए आप डिफरेंट बुक्स जो हैं उनसे स्टडी कर सकते हैं. ओके क्लास, अगर आपके पास कोई क्वेश्चन नहीं है देन